Hello and welcome to our video on bird flu. Bird flu, also known as avian influenza or H5N1, is a highly contagious viral disease that primarily affects birds but can also be transmitted to humans. In this video, we'll be discussing the symptoms, causes, diagnosis, treatment and prevention of bird flu. What is bird flu? Bird flu is caused by a strain of the influenza virus that primarily infects birds, particularly poultry. However, it can also be transmitted to humans who come into close contact with infected birds, their secretions, or contaminated surfaces. History of bird flu. Bird flu, also known as avian influenza, has been known to exist in birds for centuries. The earliest known outbreak of avian influenza in birds occurred in Scotland in 1878. In 1997, the H5N1 strain of avian influenza was found to be causing severe respiratory illness and high mortality rates in humans in Hong Kong. This outbreak resulted in the culling of over 1 million chickens in an effort to control the spread of the virus. Since then, there have been several outbreaks of avian influenza in birds and humans around the world. In 2004, a strain of H5N1 avian influenza spread to several countries in Asia, Africa, and Europe, causing widespread bird deaths and several human fatalities. In 2013, a new strain of avian influenza, H5N1, emerged in China and caused severe respiratory illness in humans, leading to several deaths. Bird flu continues to pose a threat to both bird and human health, and efforts are ongoing to monitor and control the spread of the virus. Structure of avian influenza virus. The bird flu virus, also known as avian influenza virus, is a type of RNA virus that belongs to the orthomyxoviridae family. The virus has a spherical shape and is surrounded by a lipid envelope that contains two types of glycoprotein spikes, hemagglutinin, HA, and neuraminidase, NA. The HA protein plays a critical role in allowing the virus to bind to and enter host cells, while the NA protein helps the virus to exit the host cell after replication. The viral genome of bird flu virus consists of 8 segments of single-stranded RNA that encode for 11 proteins. These proteins are responsible for viral replication, assembly, and infectivity. The structure of the bird flu virus is important for understanding its pathogenesis and developing antiviral drugs and vaccines. The HA and NA glycoproteins are the primary targets for antiviral drugs and are also the basis for the development of vaccines. How bird flu transmits. Bird flu, also known as avian influenza, primarily spreads among birds through direct contact with infected birds, their feces, saliva, and respiratory secretions. Infected birds can also shed the virus into the environment through their droppings, which can contaminate water and surfaces. In rare cases, bird flu can also spread from birds to humans, particularly those who are in close contact with infected birds. This can occur through inhalation of the virus in the air, or through contact with contaminated surfaces or materials. Human-to-human transmission of bird flu is very rare, but can occur in certain circumstances. This typically requires close contact with an infected person, such as caring for someone with the disease. It is important to note that not all strains of bird flu virus can infect humans, and human infections are usually associated with certain subtypes of the virus, such as H5N1 or H7N9. Pathogenicity of bird flu virus. The pathogenicity of bird flu virus in humans varies depending on the subtype of the virus and the individual's immune response to the infection. Some subtypes of the virus, such as H5N1 and H7N9, have been associated with severe respiratory illness and high mortality rates in humans, while other subtypes may cause only mild or no symptoms. In general, individuals who are elderly, immunocompromised, or have underlying health conditions such as heart disease or diabetes are at increased risk of developing severe illness from bird flu virus. One of the key factors in the pathogenicity of bird flu virus in humans is the ability of the virus to replicate and spread within the respiratory tract. This can lead to severe inflammation and damage to lung tissue, which can result in respiratory failure and death in severe cases. Symptoms of bird flu. Symptoms of H5N1 in humans can include fever. A high fever is a common symptom of H5N1. The fever may be sudden and can be as high as 103 to 106 degrees Fahrenheit. Cough. A dry cough is another common symptom of H5N1. The cough may be severe and persistent and can lead to chest discomfort. Sore throat. A sore throat is also a common symptom of H5N1. It may be accompanied by a runny or stuffy nose. Difficulty breathing. Some people with H5N1 may experience shortness of breath, chest pain, or difficulty breathing. Fatigue. H5N1 can cause extreme fatigue and weakness, which can last for several days. Gastrointestinal symptoms. In rare cases, H5N1 can cause gastrointestinal symptoms such as diarrhea, abdominal pain, and vomiting. In severe cases, bird flu can cause acute respiratory distress syndrome, ARDS, pneumonia, and other life-threatening complications. Some subtypes of bird flu, such as H5N1 and H7N9, have been associated with high mortality rates in humans. Diagnosis of bird flu. Since the symptoms of bird flu can be similar to those of other respiratory illnesses, it is important to consider a patient's exposure history and any recent travel to areas with reported bird flu outbreaks. Laboratory tests can help confirm a diagnosis of bird flu in humans. These tests may include polymerase chain reaction, PCR, testing. This test can detect the presence of bird flu virus RNA in a patient's respiratory or blood sample. Viral culture. This test involves growing the virus in a laboratory setting, which can provide information about the subtype of the virus and its sensitivity to antiviral medications. Serological testing. This test looks for antibodies against bird flu virus in a patient's blood sample, which can indicate whether the individual has been infected with the virus in the past. Chest X-rays or CT scans. These imaging tests can help evaluate the extent of lung damage and identify any complications, such as pneumonia. Treatment of bird flu. Treatment of bird flu in humans typically involves antiviral medications, supportive care, and management of complications. Supportive care for the treatment of bird flu may include measures to reduce fever, oxygen therapy to support respiratory function, and fluid and electrolyte replacement to prevent dehydration. In severe cases of bird flu, complications such as pneumonia or acute respiratory distress syndrome, ARDS, may develop. Treatment of these complications may require hospitalization and intensive supportive care. Prevention of bird flu. Preventing bird flu in humans involves a combination of measures to reduce the risk of exposure to infected birds or their droppings, as well as measures to prevent the spread of the virus among humans. Here are some key prevention strategies. Avoid contact with sick or dead birds. If you live in an area where bird flu outbreaks have been reported, avoid contact with sick or dead birds, and do not handle feathers or other bird products. Cook poultry and eggs thoroughly. Cooking poultry and eggs to an internal temperature of at least 165 degrees Fahrenheit, 74 degrees Celsius, can help kill any viruses that may be present. Practice good hygiene. Wash your hands frequently with soap and water, especially after handling poultry or other birds. Avoid touching your eyes, nose, or mouth with unwashed hands. Wear personal protective equipment. If you work with poultry or other birds, wear protective clothing, gloves, and a mask to reduce the risk of exposure to the virus. Stay informed. Keep up to date with information about bird flu outbreaks in your area, and follow any guidance provided by public health officials. It is important to note that vaccination is not currently available for all subtypes of bird flu virus, and there is no specific vaccine for the H5N1 or H7N9 subtypes that are most commonly associated with severe illness in humans. However, efforts are ongoing to develop effective vaccines and antiviral medications that can target bird flu virus and prevent its transmission. Conclusion. In conclusion, bird flu is a highly contagious viral disease that primarily affects birds but can also be transmitted to humans. It is important to be aware of the symptoms and take steps to prevent infection. If you experience any symptoms of bird flu, it is important to seek medical attention immediately. Thank you for watching, and stay safe.